A very warm welcome to Kigali. It is a real pleasure for me to join you at this opening of this Regional Health Campaign Integration Workshop. We are gathered here, colleagues from across the region, to share experiences and agree and chat together a path forward on how we can have more coordinated, efficient health campaigns.
So campaigns are a critical approach that we have for delivering interventions. Oftentimes it's where communities are not reached through routine communities, health centres with certain interventions. There are positions in the facilities where people are waiting to have services. So that's really the idea of integration, is a collaborative approach and that coordination. But also, as I said, it's not just about the co-delivery piece, it's about sharing micro-planning, sharing trainings, having that, broader view of where you can try and work together more and try and offer, a package of services, but also ensure that your healthcare workers, your supply chain, your logistics, waste management, all those things are being kind of coordinated instead of having them all, done separately. It's the first time we brought countries together to discuss campaign integration. So this is the first global meeting to discuss this area. And I think it's been really eye-opening to hear the perspective from countries about how they have been advancing already with integration and how they can do more to integrate campaigns going forward.
Integrated campaign digitization refers to the sharing of solutions and assets across multiple campaigns. So when we talk about integrated digitization, we are approaching this from two different points. The first one is the integration across multiple health campaigns, meaning malaria with NTDs or with immunization and so on. And the second level of integration is actually between the campaign data tools and what's already available at the country level in terms of digital ecosystem.
As Ethiopia, we used to do a number of campaigns in a year. In our situational analysis, we found our campaigns per year is 9 to 25 campaigns, average of 14 campaigns. But now we are able to make this campaign into only 5 campaigns in a year. So this will save a lot of costs. It also helps to reduce the missed opportunity. We do have budgets for each campaign. So the sum of each campaign were like 21 million. But now we used $11.3 million, which saved us 9.5 million in monetary terms, in addition to the time and the energy saved to our professionals.
We have quite a number of health campaigns in Nigeria, and most of them were siloed. So the collaborative action strategy presented us an opportunity to be able to demonstrate that we can integrate health campaigns in a way that is efficient and reduces the burden on the community and the health system as a whole. Nigeria, together with Ethiopia, piloted the Nigerian collaborative action strategy for health campaign effectiveness. And as such, we're able to demonstrate that it is possible to use integration to improve the efficiency of health campaigns.
With all of what has happened over the last few years and the evidence from both countries, we see that things can be done very differently. And one campaign, one visit, a lot of things changed. When Nigeria and Ethiopia stopped running campaigns in silos, 4 things shifted: communities, health workers, systems, and funders. More coverage, less money.
Integration has to be a default, that at the start of planning cycles, we all have to really think, before we start doing our campaigns, what other program can we integrate? And what other opportunities exist that we can actually co-deliver?
We started with the overview on the first day and learning what is happening as far as campaign integration is concerned. We had lessons from Nigeria and Ethiopia. And these have opened our eyes in terms of what practically campaign integration means. On the day 2, we started on the different campaigns, mapping the different campaigns that happen in our countries. And also today we have started on, that is day 3, on understanding the effectiveness of these integrated campaigns. The challenges we encountered in Uganda, especially on the tools that can help us to monitor effectiveness of integration. We did not have this. We tried to come up with some, because each campaign had its own tool. The micro-planning, we managed to agree that we use the same tool. But when it came to the data collection, each program has their own detailed list of indicators that they correct. And it was not very easy to have all the 2 programs indicators in one platform. So this workshop comes in handy, and I think we are going to build on that effort that we have started as a country.
Il nous a été donné des outils sur la planification, d'abord sur la compréhension même du principe de l'intégration, parce que l'intégration, c'est vrai que ce n'est pas une fin en soi, mais ça permet d'assurer une certaine efficacité. Ça permet aussi aux bénéficiaires qui sont des populations de ne pas être fatigués, d'être visités par plusieurs interventions de santé. Et c'est aussi qu'on a compris que sur le plan de la couverture, ça permet aussi de faire une certaine couverture des populations qu'on vise, et notamment sur le plan financier, aussi sur le plan des ressources. Ça permet aussi de capitaliser certaines ressources, de gagner des ressources de plus, de gagner des journées de travail de plus.
It's in our hands. It's in this room. If you want to integrate and to make it a success, please don't be afraid. And it works. And by the time you start integrating, it becomes easier for all of us to reach more people, but also to use our resources efficiently.
The way forward after this workshop is really for countries to begin discussions internally and try and get that high level buy-in and leadership. I think countries need to really recognise that in order to move forward, they have to have the leadership and governance in place to really drive this forward. Begin to look at how they can change policies so that they can make adaptations to how their current models are for delivering campaigns. And then there's a lot of work to be done for the countries, but the first step I think is recognition that we have to do things differently.
It's important for us to recognize what exactly is our definition for campaign success. I think historically for a long time we have leaned and depended on coverage as really being the most important measure for campaign performance. But I think what we're realizing, for years we've been rolling out various interventions and it seems that we're really struggling to reach the last mile.
Nous allons mettre à l'échelle cette intégration-là et nous allons mettre aussi sur pied les structures de coordination pour rendre formel ce que nous faisons sur le pays. Et je pense que cet atelier était une opportunité pour le Tchad parce qu'à travers les échanges que nous avons eus pendant les 3 jours, nous avons beaucoup tiré des leçons positives et cela nous permettra d'améliorer cette intégration dès notre retour au pays.
For Sierra Leone, I think at this particular point, and on return, our topmost priority will be, 1, to get the buy-in and actually to set up a coordination structure for the integration, the campaign integration. So the buy-in and setting up of a coordination structure.